Good morning, Doc. Welcome to this dialogues with Vega Schools.
Morning,
I hope you're
Sandy.
doing
How are
well.
you? Yeah, very good. Thank you.
Okay, great. So, just a quick introduction. You are a sports medicine and sports injury specialist from Nottingham, UK. You are a prolific columnist with the Hindustan Times. You you are on the leadership board of Vega Schools, and you've been talking a lot about the situation with the pandemic and how to ease people's concerns and fears. Unlike many of the Western nations, India is in a bit of a serious situation with the double mutant, and only as we speak, only 2% of our country is double vaccinated, and about a little over 10% is single vaccinated. And according to the expert of the Pfizer vaccine, who was behind the Pfizer vaccine, BioNTech, founder Ugur Sahin, he said that the pandemic is expected to last in the developing world at least until middle of 2022. There are also some statisticians who are saying that vaccinating India may take as much as 2 years. So the question is that in this scenario, what can we do while everyone's trying to scramble and get us vaccinated? Um, you're a sports and fitness expert, so I wanted to talk to you about how fitness and exercise could reduce the COVID impact. And more importantly, what is the evidence around reducing the impact? And specifically, what kind of exercise and fitness would you recommend that people who fall sick, are don't suffer from aggravated symptoms? But I think what's important is to sort of get a sense from you around the data around this. So
Yeah,
would love for you to share your views.
yeah. So thanks, Sandy. What's very important is to understand that as we are waiting for vaccines to come along and roll out, and we as citizens who are not in the business of vaccines and the government really can't do much about it. We can just wait for it to come along. But what is very encouraging, there's tons we can do other than vaccine, because it seems right now that we're just waiting for either vaccines or we are waiting for us to get COVID. I mean, it seems like that. It doesn't have to be. And there's a lot of evidence. Last year, there was a study done which looked at people, this was done in California on 48,000 people, 48,400 people. And they looked at people who had been active for 2 years prior to that. And if they'd been active for 2 years, because they were the patients previously as well, they saw that people who were active, when I say active, 30 minutes of physical activity, 5 days a week. So like 150 minutes in a week is what they were talking about. They saw a difference of 2.5 times. So if you're physically active, doing that kind of activity for 30 minutes a day for 5 days a week, you have 2.5 times lesser chances of, for example, COVID-related death, COVID-related hospital admission, as much as that, as high as that. Now that's seriously insane. Like, why is there no one talking about it? ICU admission were lesser in them by 1.73 times. So those are very high numbers we're talking about, because in India, currently we are at an average of 4,000 deaths per day for the last few days, week or more. Imagine we could have saved 2,400 of those deaths had we been physically active, had we been in better shape. And one thing that we've been talking about throughout is comorbidities. How well are you otherwise? Do you have hypertension and diabetes and other chronic diseases? And that we've known it for a very long time. They are very closely connected to physical inactivity, fitness, health. So those are very, very closely connected. It's not about, because I've been getting messages, so it's really interesting times, right? Twitter and things. You get suddenly start getting trolled because you talk like physical activity can be good for such a thing, but it is. It's not about supporting the government or against or anything, but there's so much evidence in favor of it. So I think what we can do starting today, I mean, we can't change the last year or the year before, we can start from today. It's very important that we all start becoming more active and help our friends and families and loved ones to get active as well. One thing that's becoming very, very evident right now, and it probably will apply to both of us as well. Uh, Role models. We used to have role models from Bollywood and cricket and basketball and football, whatever. I think they are not necessarily the best role models, because when things were really bad, the IPL was going on and no cricketer was coming out and saying, this is really bad. So I'm not even saying stop IPL. I'm saying, did they even recognize what was going on in the country? Okay. And here are boys and girls, big fans of theirs. Which Bollywood actor came out and said, guys, we are with you? Not one, right? So what I'm really saying is, we as parents, we should be the role models, not by telling our children to be active, but actually showing them how it's done. So it starts from us. We have to take that role on, because no one else is going to fix it for us. And it seems like right now even the government isn't fixing it for us. So we have to do our bit, please.
Yeah, no, I think that's very interesting. While I also resonate that in India we may need to expand our list of role models. We have no problems film stars and sports people being role models. They work really really hard, but we need to possibly expand the number of the categories of people we look up to, our children look up to. So that's I agree with you to the and and there's nothing greater than a parent being a role model. We at Vega talk a lot about the participation with a parent in educating, in bringing up a child, in imbibing values in children. And at Vega, we are also very big on sports and fitness, but more from the perspective of lifelong sports and fitness, because many children and many of us did sports in school, but as time progressed, we stopped playing, we stopped running, we stopped. So we put a lot of emphasis on lifelong sports and fitness, and the numbers that you shared are incredible. They are phenomenal. That if you simply exercise for 30 minutes a day for 5 days a week, you can reduce deaths by 2.5 times, and you can reduce ICU um, going to an ICU by 1.7 times. That is incredible. That's a staggering figure. So that's a big one. We're gonna share that with the world. We are sharing that with the world right now. I also wanted to briefly talk to you about vaccines. We are slowly ramping up vaccine capability, and even though maybe we haven't done that well in over the past few months, but looks like we are really ramping up. And my sense is we will really ramp up now. So I wanted to ask you that once we've been vaccinated, is there anything we can do specifically to make vaccines more effective for us? And because I know a lot of people right now who've been vaccinated once or twice and I still have COVID, and we all know that vaccines essentially don't allow the infection to affect the lower respiratory tract as much as it used to. It'll still impact our upper respiratory tract and perhaps the lower tract also to some extent. But what can we do in terms of sports and fitness and good health that we can make vaccines more effective? And if there's any
Yeah, so
data around it.
no, sure there is. So before that, Sandy, the point you raised about the role models. So the other issue I have with it is, we look at, say, like a cricketer or a footballer, and what we as adults and children don't appreciate enough, or actors, what we don't appreciate enough, that is that's their work. That's their 24/7. That's what they need to be doing. For us, it's one of the things. It's not the only thing, right? And what we look up to them, but we end up giving up very soon, saying we'll not reach to that level. It seems very far fetched. And I'm glad you're saying it's a lifelong sports that you're talking about, rather than saying, can I run 100 meters in 10 seconds or something like that, right? And no activity after that. So lifelong is the thing. And what we as parents and grandparents, can actually part to each other becomes a very important part. So it's lifelong activities that we're looking at. And coming to statistics about the role of physical activity yet in vaccines, again, a very interesting study. So this study was done over 40. So it was looking at research done over 40 years. So all that good studies that were coming on, and they were looking at what is the role of physical activity or inactivity in vaccination of infectious diseases. So it wasn't about COVID in this case, but it was about infectious disease across the board, 1980 to 2020. So that's a lot of time. And they realized that it again changes how the antibodies are made after vaccination, how immune you are to the disease if you've been physically active before vaccination. It changes this dramatically. So again, it takes me back to cricket. So we both are from that age when Azruddin was he changed fielding, and how he changed fielding was before that fielders used to wait for the ball to come to them, and then they used to react to it. Whereas what Mohammad Azruddin started doing was he was attacking the field. He was attacking the ball, right? So the twos were converted to ones were converted to zeros. And where there were no catches, he was catching those balls. And it changed the game totally from Indian perspective. And as far as COVID goes, that's the thing we need to be doing. We need to be taking a very proactive role saying, let's wait for the disease or the vaccine to come. Let's do that. And again, physical activity is going to play a very important role in that too. So whether it be generally just the disease itself or the vaccine, activity is going to be very important. And it's about the right amount that all of us can do. So when you ask me, what can we do for it? It does not have to be running a marathon. It does not have to be going to the gym. It can be done very well, easily at home. And since, again, we're talking about the lungs, the pulmonary, respiratory system first, there are very simple exercises we can actually do, breathing exercises, without any tools whatsoever. And the very first one is, again, let's compare to sports. In sports medicine or as a running mentor, people would come to me and say, I get breathless after 5 minutes or 10 minutes of running. My simple question to them is, if you can't breathe well while sitting down, how do you expect yourself not to be getting breathless when you go running and 5 minutes you're breathless? So that's something that people need to be aware of, that listen, can you just consciously breathe when you're sitting down first, right? Can you do it while lying down? So consciously just taking a long breath in, and then you're just breathing out. You repeat again. And each time you take a breath in, hold that breath for a couple of seconds. Now, this could be very fun for children, but even for adults, it's a very good example. Imagine there's a bus that's coming loaded with oxygen and carbon dioxide. So it has more oxygen, less carbon dioxide. And it comes into your lungs, right? So that breath has come in full of oxygen, okay? Now, if the bus does not stop in the lungs and it moves off very quickly, basically that oxygen doesn't have enough time to get off at the bus stop, all right? And the carbon dioxide doesn't have enough time to get onto the bus, right? So we need to slow down the breathing, because when it's shallow and fast, it's not making enough sense, right? So what we need to do is, again, take a long, deep breath in, hold it for a couple of seconds. It is not about yoga. It's not about religion. It's about simple science. And yoga there's a lot of science there. But I'm just saying, it is not about just following a Babaji or something without knowing why. And it's a very simple thing you need to understand, what's going on here. So please, mindful breathing, if people can do for a minute or two every hour, while they maybe are before sleeping, when they get up in the morning, right after that, they've been working for long hours, can they put an alarm every 1 hour? Mindful breathing for a minute only, okay? While standing, while in the kitchen, while maybe standing and talking to whoever, just mindful breathing again. Now, very relevant, because if it's a lung disease or it hits the lungs first, and if your lungs are not strong enough to do this simple thing, you're in more trouble. So please start with this. Of course, the next level up is the respirometer. I have it around, I'll show it at the end maybe, where the 3 balls are there and you're kind of, breathing in and out of that thing, and those 3 balls go. So there it's a great resistance lung exercise, that's one. And in today's world, anyone who's been through COVID, they've been given that little tool. So that becomes a very important one yet again, okay? So that's about the breathing. Then it comes about strength training. Now, a very simple analogy yet again is, Maruti 800. I mean, again, both of us are from the time when Maruti 800 had come along, and probably most of the families, that was the first car. Uh, Before that were Ambassador and Fiat. Like Ambassador was a car with a lot of free iron that you used to get, all right, a lot of metal, for no rhyme or reason. And as much as the engine was very powerful, it wasn't able to carry very far. The average, the mileage wasn't very good. Whereas the
Yeah.
Maruti was a small car, and the engine was very powerful versus weight. So as much as it was a small one, but it was more powerful. Now, what I'm really getting at is our muscles need to be working. If we have weight which is fat, fat you have to carry. Whereas when it's muscle carries you,
Yes.
right? So it's an asset versus liability kind of a situation that we have. So what we need to do is we need to become more of a Maruti, which is more fuel efficient.
Yeah.
It seems lean, but at the same time, there's muscle on it. So that's the kind of thing we need to work towards.
Yes.
And no rocket science. There's no need for a gym. None of that. Very simple things can be done. Like a very simple one, people whoever's here listening to us, if you just sit up on a chair, you get up and you get down again. So sit on the chair and you get up again, right? When you're doing that, you're doing a squat each time. And we all do a squat throughout the day. So it's a very
Yes.
simple way to think about it rather than saying, oh my God, I can't do a squat. Everyone does. Even with people with knee pain, even whatever age, children, everyone does a squat. So again, it becomes a very good strength exercise because you're working your lower body very well. You're working your quads very well, your calves, your lower back, your butt very well. So that becomes a very easy exercise everyone should be doing, right? The second that I really am a very big fan of, the third exercise, are heel raises. So when people are standing, just go on your heel, raise your heels up and down again. Do it multiple times a day, maybe 10 times in one go. Your calves work like a second heart for the human body. It's pumping the blood back, right? And it's activating that muscle again. So it becomes a very simple exercise. You don't need any tools whatsoever. And whatever age can do it. And a third that I really like is, of course, we can go expand to like, doing a plank or a push-up, but imagine there's an orange between your shoulder blades. You have your hands up and you're just taking your hands back. So I mean, I don't know if you could see that, but your hands are just going back and forth like that, right? So what you're doing is imagine that orange between the shoulder blades and you're squeezing it. What happens because of long times of sitting in front of the computer, you're leaning forwards, your upper back has got very weak. And what you're doing is you're opening up the chest by doing that little movement here,
Yes.
or yes. So it becomes a very simple exercise, again, all across ages, easy to be done. And the idea is, can we pick up 3, 4 exercises like that, which cover the whole body? These pretty much do. Uh, coming to kids, things like skipping, for example, don't make it like a chore. Don't make it like a, it has to be like a punishment yet again kind of a thing. It doesn't have to be at all. It needs to be fun. And skipping rope is a very cool one because most kids will struggle initially because they've been sitting on their backsides for too long. But
Yes.
it'll take them 2, 3 days to figure what is that whole coordination about.
Yes.
And it's fascinating. Even a 3-year-old can actually skip. So we need to just figure what age group, what makes sense. And I would go back to the same thing about be the role models because I had some videos to share, which I'll actually share with you later. But when parents do it, children do it with them, and they do it for fun and don't worry about the form too much. The whole family just stands together and does these 10 squats together or the heel raises together. And it becomes a lot more fun. So
Yes.
again, lead by example rather than just preaching. And that's a very important message for parents, really.
That's very interesting, Doc. I love your analogy in both cases. I loved your analogy on how Azharuddin changed the game with fielding. I actually thought it
Yeah.
was Jonty Rhodes, but you're right. As far as India
Yeah.
goes, it was Azharuddin, no doubt about that. And I think people like Virat Kohli and Jadeja have changed the game, taken it many levels or notches higher. So I think essentially what you're saying is that parents now need to become the Virat Kohli, Jadejas, and Azharuddins, the role models, and change the game with vis-a-vis fitness and exercise, so that we can cut down the impact of COVID on our bodies, and and really win more. So I think the analogy there is that the way India started winning more and more games by cutting down the singles and the twos, we can we can start doing these very simple basic exercises and really cut the impact of COVID, increase the impact of vaccines, enhance the impact of vaccines, and win more against the vaccine. I think it's a really beautiful, elegant, simple analogy. And as we reopen in June, of course, we are opening online. We will definitely incorporate some of these very simple tools in the physical in the physical education sessions that we have with our children, and we'll try to see if we can also include parents in some of those sessions, so that all your ideas can be put into action. So that's very powerful. Doc, another question that we were talking the other day, and you shared something very interesting with me. You shared that, the scores of patients who come to you, you're finding that the grandparents are actually the healthiest, followed by the parents who are not as healthy, and finally the children you're observing are the least healthy. Now that was very surprising to me, um, and uh, and I was thinking that what would be some very simple basic exercises for children and for parents, and how do they differ? I mean, since you're talking about parents being role models, do they need to work out in a similar way or differently from how children should work out? What could be the similarities and what could be the differences between what the children could do for that half an hour in a day and what the parents could do in that half an hour? So are there any similarities and differences, or can they pretty much do similar things? Would love for you to share some quick insights on that.
So one is, I think we need to make making it more fun. We need to go back to our own childhood. For us, when it was holidays, when it was the summer vacation, as hot as it was, we were in the park and we were jumping around. And I think that's a very important part that's missing today. That's not the case. So what needs to happen is, can we parents just go to the park, the whole family, rather than just the runners go out and the whole family is sleeping otherwise? No, I think the whole family needs to go out. Maybe people like you and me could go for our runs for a 5K, 10K, whatever it be. But could the frisbee be taken along with us? Could be the badminton rackets be taken? So could it just be a game? Could it just be about movement? So the issue is, we should not we should go away, walk away a little bit from making it very standardized also. The game part of it, the fun part of it needs to come into play. That's a very important part. But I would go back to the same again. As parents, we need to also do things that they're doing, because if we don't, they feel left out and they're like, give me the phone and I'll be busy with that again. So, and that's the biggest issue. So we need to just, do both. One is make it more fun while we do our, if it were serious business, but also we need to lead by example, be involved with whatever they're doing. In addition, the big thing that's actually gone wrong in last 2 decades or so is the smartphone and the other gadgets that are there, similar gadgets. I think all of us need to lead by example again, saying, it's easy to preach to the child saying, put the phone down after whatever time, when we are totally occupied with it, for 24 hours a day. So we need to do it together. That, listen, here's my phone as well, and you put yours as well. And for next 1 hour, we'll not use it. And it's okay, do whatever. So I think these are some tools that, again, we can be using. So on one hand, yes, increase the physical activity time, but screen time as well. Can we start reducing it also? And can we make it more fun life? Because like my son would always ask, who's 15, you're telling me not to use the computer, but then what? Right? What do I then do? So that we need to come up with. Again, games like chess, for example. Why are we not playing chess on a board rather than on a phone? So I'm just saying, go get away from the screen. So it's the two things that we need to balance out. Get more active, less screen time.
Yeah, no, that makes a lot of sense. And of course, what we can do is that maybe after this session sometime later in the week, we can maybe just jot down very simple ideas for exercises for parents and for children, some things that they can do in a fun way. I think, most exercise manuals or videos just focus on the exercise. They don't focus on the fun quotient. And I think it's a very, very powerful idea that how can we as parents become the Azruddins, the Virat Kohlis, the Jadejas, and bring in the fun component in the workout. I think if we can do that, I think that's the sort of, looks like that's the name of the game. In fact, I was just reflecting. My son and I, we go to the park almost every day, and usually we play a sport or the other, and he loves playing the sport. He loves playing sports, but sometimes I want to go for long runs, and he's not as fond of long runs as he's of sports. So what I did with him was, I said, you know what, a couple of weeks ago, I said, let's go for a long run, and after the long run, we'll go to a cafe and we'll have a delicious drink each. So I remember I got him a elderflower lemonade that he chose, of course. And a couple of days ago, I told him, I said, should we go for a run again? And he's like, yeah, 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 let's go, let's go. So while we were running, it was a fairly long run, and he's a 12-year-old kid, so it's not that easy. So while we were running, I could see he was struggling a bit. And when we sort of finished running, he told me, he said, Papa, I was really tired in the first 25% of the run, but I kept going. And you know what motivated me? It was this elderflower lemonade that we we have after the run. So it was as something so simple, and of course, I never intended it. It
Yeah.
just sort of spontaneously came to me that let's have a delicious drink each after the run. But I
Brilliant.
think it gives a very powerful cue on how we can bring the fun quotient in exercising with our. So I think I think for me the biggest learning um, from this session really has been that statistically, mathematically, it is very, very uh, easy to bring down the impact of COVID, the impact of infection, the impact of hospitalization. And statistically and mathematically, again, there is a very it's very easy to increase the efficacy and effectiveness of the vaccines by doing some very simple exercises. And um and the fact that the best way to do that is by, for parents to become the role models. And as we become role models and as we do it, the most effective way of doing it is uh, is to be able to find and bring the fun quotient in in the exercise. Because and I see a lot of analogies, because we in the last 10 years or so, there's been a lot of research on metacognition, on learning to learn. And the research essentially has found that the way schools have been making children learn is the opposite of how great learning happens. And there is a way to instill the burning desire to learn in children. And that happens when you bring the fun component, the fun quotient. So when we start learning at Vega, we always start with something called Get in the Zone, GITS activity. With and all the learning is crafted around uh, projects that are doing projects or solving problems that are relevant, that are fun, that are engaging. And we find that the learners are so much more excited to learn. And of course, again, the parallels between exercise and learning is that there is a lot of data now that supports that when you have a burning desire to learn, when you're motivated to learn, which of course is a function of learning something when that you find interesting, that you find fun, then the chances of your attention levels going up are significantly greater. And if your attention levels go up, your retention goes up. And if your retention goes up, then you're more likely to remember what you've learned. And that will also positively improve test scores, exam scores, and of course, and make that learning relevant for life. So there are just so many analogies and between learning and fitness and sports, and the same fundamental principles apply. The same principles that apply to cricket as well. The great
Yeah.
analogy and examples that you shared. So yeah, I mean, I think this was a very insightful conversation, Doc. And I know you're extremely busy. So thank you for joining us on this dialogue, and I'm sure it'll really help um help people. And maybe what we can do is we can make a one pager uh, of uh, of things that parents and children can do together that are not only um, exercise but also fun. So I think that's my learning of today, and I'm going to pick your brains on this, and we find a way to share it with the world.
Thank you, Sanjay. Thank you for having me.
So take care, have a good weekend, and speak soon.
Yeah, you take care. Bye bye.
Bye bye.